I was having problems with my lower back, and my life was kind of degenerating. I was having trouble with losing feeling in my legs, and I could see that this was spiraling downward. And I went to see the doctor, and he told me that the only treatment that was going to help was surgery, and wanted to be able to fuse my back. And I was not, I didn't like that option, and I wanted to find something else. I'm really glad to find the Minnesota Disc Institute, and the success I've had here is just unbelievable. I can't believe it, and I would really encourage anyone to go here.
Excellent, man. What kind of symptoms were you experiencing before you came in?
Pain in my back, and it would go down my legs, the sciatic, and I would lose feeling in my leg, and it was getting to the point where there were times when my leg would give out, and I'd almost kind of stumble and fall. And I've always been a very active person, and this was really traumatic for me, and I'm really pleased. My quality of life has improved by a factor of 10, I'd say. My wife just can't believe that she's got her old husband back. So
Fantastic.
it's really great.
That's great. And what kind of treatments had you tried before, Mike, before coming here?
I tried just about everything there is. I tried all kinds of exercise. I went to the surgeon, and of course he thought surgery was the only hope, but he recommended physical therapy. I tried that, and I tried to encourage the therapist to do everything he could to heal me, and that was a big improvement. It allowed me to still function, but I could see that wasn't the whole answer. So I'm really pleased to be able to find the Minnesota Disc Institute, and I would recommend anyone.
All right. Praise God, Mike. Thank you.
Hi, my name is Mellie. I am from Blaine, Minnesota. I came in February with an L5-S1, pretty major herniation. I wasn't able to walk or sit up or basically do any activities from day to day. I came in, progress was a little slow, but I could tell at first that my body was starting to respond, and as time went on, I was able to walk and sit up, and within a couple months I was able to drive, and now 6-7 months later I'm able to basically function on a day-to-day basis like almost nothing ever happened. So I thought this was a great alternative to surgery, and it really, I was very happy I was able to heal my body instead of just cut the disc off and deal with the scar tissue issues later in life. So I'm very thankful for the Minnesota Disc Institute. It helped me tremendously, and I'm so grateful. It really helped me a lot.
That's awesome, Melanie. And tell us about your pain a little bit. What kind of pain were you having when you first came in?
Well, basically my entire right leg was seized up with pain. There were a few points when my leg actually locked up. It was so bad I couldn't bend, lift, do anything really. I couldn't shower for more than a minute or so.
And you had tried several different therapies, correct?
Yes, I went to a few different chiropractors. I did acupuncture. I had a cortisone shot, and I did physical therapy. So that was kind of all the different therapies I had tried.
Yeah, excellent. So you're doing great now. That's fantastic.
Yeah, thank you.
All right, praise God. Thanks, Melanie.
Hi, my name's Steve Link, and I'm from Stewart, Iowa. I've had back and neck problems for probably the last 8 to 10 years. I've tried physical therapy. I've been on OxyContin for probably the last 4 years, and it's gotten to where it was doing nothing for me. And my sister-in-law referred me up here to Dr. Jamie's, and I came in here. I couldn't even turn my head to the left or right. It hurt so bad, and I had headaches every day, and also had tingling in my hands. I couldn't feel my hands. And within 3 or 4 weeks after treatment, I've got almost all my range of motion back and no headaches, and I'm totally numb and tingle free in my hands and my arms. And I would just recommend this place to anybody, and the doctors here and the staff are really great too, and that's about all I can say. Helped me out tremendously.
Antoine, because I had severe back problems. I went to the Mayo Clinic 2 or 3, 4 times. They told me I needed physical therapy for my back, and I tried physical therapy 2, 3 times. It did nothing for me. I had a epidermal injection in my back. It helped for a short period of time. I seen a vascular doctor 3 or 4 times, which did not help at all. I was eating Percocet at one time, 2 or 3 within 4 hours because of severe pain in my back, where I nearly had tears in my eyes and passed out. Nothing seemed to work. I went to a chiropractor, and it seemed like they did more damage to me than good, because I did have apparently 5 herniated discs. And then after listening to WCCO and learning about the Minnesota Disc Institute and speaking to Dr. Jamie Antoine, he told me that they could help, and I says, well, I have nothing to lose. I've gone through 19 sessions. I feel like $1 million. I have no back pain, no pain in my legs, and I would highly recommend this place to anyone to at least try it. It's better than surgery. Thank you.
Hi, my name is Kim Johnson. This is my neck. It was pretty messed up when I came in here. I had severe pain on my left arm and shoulder. It was shooting down my arm into my hand and my fingers, and I was in constant pain. There's a lot of things I couldn't do for myself, and the most comfortable position was laying down. Now, about 4 weeks later, I'm about 75% improved. I can take care of my personal needs as much as I want. I've got more energy. I feel great. There's no shooting pain in my arm anymore, and it's just an achiness in my shoulder. Things are going great.
My name's Dan. I came into the clinic to have my back. I had pretty severe lower back pain. Left knee bothered me a lot, and had numbness on the top of my foot. Once I started the plan, taking the vitamins, drinking the amount of water, doing the care here 4 times a week, and then 3 times a week, my back pain got a lot better very rapidly, and now I'm almost through the program, or well along, and I basically am down to 0 back pain, and it's been incredible. I would recommend it to anyone.
My name is Jeff Bodette. I live in Prior Lake, and I came in here because I had a cervical fusion and a lower lumbar fusion, and because of the fusions, my discs above and below the fusions were wearing out, and I was noticing started getting zingers and just generally losing my flexibility. And I knew I had to do something for the long term, and I really didn't have a re-injury, so to speak, but I came in here just to try to better my position and for the long term in life. And when I used to wake up at night or wake up in the morning, I would always have a big old kink in the right side of my neck, and I don't have that at all anymore. And my flexibility is much improved. And just my day-to-day, I mean, waking up, I'm not all kinked up like I used to be, and my flexibility is better. And when I play sports now, I notice I can twist a lot better, and just my overall health is better, it seems to me. So, I highly recommend this. It's probably something I'll have to do for periodically the rest of my life with my situation, but it's, in my opinion, something that I can't live without. So.
Hello, my name is Dr. Aaron Moreland. I'm a doctor of chiropractic, and I own Vallejo Health and Wellness Center in Eden Prairie, and I'm also the clinical director here. I just want to talk to you a little bit about the Minnesota Disc Institute and Dr. Jamie Antoine. I just want to tell you about some of the patients that we've referred over to him, and just wanted to specifically talk about one that we had sent over recently. In our office, we do see a lot of people that have low back pain, neck pain, and such, and do see great results with them, but there are times when we find that we do have to refer them out to somebody, a specialist. And I think of just one recently that had come in. A few years ago, she had come into our office because she was dealing with some low back pain, pretty significant low back pain, and she was having numbness and in her foot, and also having what we call a foot drop, where you can't put weight on your foot. And so determined that she did have a herniated disc, and at that time I wasn't familiar with the Minnesota Disc Institute, and so we had referred her over to a surgeon that we work with, and they did surgery on her, and it did help. It helped with the numbness in her leg and her foot, and also with the drop foot, but she really still had a lot of pain in her back, and we really had to see her on a regular basis for that pain. And so about a year and a half after the surgery, she'd come in again with very similar symptoms than what she had prior to the surgery. And a few weeks before that, though, I had actually spent some time, sat down with Dr. Jamie Antoine. He told me about his program, and the program sounded something like this patient could benefit from. So instead of sending her off to surgery this time, we sent her over to Dr. Jamie's office. After a few visits, I saw the patient again, and she was doing significantly better. In fact, she's recovered completely and never did have to have surgery. And so we were very appreciative of that. It really helped me to understand how much the Minnesota Disc Institute, the program that they have there, could help someone with that. And so since then, we've sent other patients over as well to get the disc healed, rather than just having more of a symptom approach that we see when with surgery or with the epidural shots. So we're very thankful for being able to work with the Minnesota Disc Institute. We look forward to continuing to work with them and seeing our patients that we can't get better here, seeing how they can help them and get their life back for them. So hopefully this is helpful for you, and that if you do have any questions, I know that they're willing to take any of your questions. And if you have any questions for me, I can be reached at 952-949-0676. Have a great day.
Stan Messner, and I'm from Hutchinson, and I tried lots of clinics with help for my issue with my neck and the headaches that kind of went with it. And I had epidurals. I went through 4 clinics for sure. A chiropractic treatment. I've had the needle work. And epidurals, I had total of now, I think there was 4 of them. And finally I stopped all of this, and then I ran into a friend who would come in here to this clinic, and her results and testimony she had. So I'm at my 4th week, and I'm doing awesome. I have mobility I've never thought I would ever get back again. I just thought I was going to deal with this forever, and I was just going to do the drugs. I was heavy on Imatrix and Tramadol, and backing off on the Tramadol a little bit, but the results so far at this point has just been awesome. I'd be willing to share with anybody or tell anybody, my situations.